Hello, welcome to the Split Household presentation brought to you by the Employees Retirement System of Texas. If you are in any of the following categories, you are now eligible for Medicare. You have turned 65, you are under the age of 65 and are medically disabled, you have end-stage renal disease. But what happens if you become eligible for Medicare but your dependent does not? This is called a split household. In addition to the scenario described above, this presentation reviews two other health scenarios relevant to those enrolled in the Texas Employees Group Benefits Program. It helps to first understand the different parts of Medicare. Part A helps cover hospitalization, skilled nursing facilities, hospice, and home health care. Part B helps cover medical services like doctor visits and outpatient care. Part B also covers some preventative services, including screenings, vaccines, diagnostic testing, and some durable medical equipment like wheelchairs and walkers. Part C, also known as Medicare Advantage plans, combines Part A, Part B, and sometimes Part D coverage and is managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. ERS offers a Medicare Advantage plan, which we'll discuss in the presentation. Part D helps cover outpatient prescription drugs. Part D also may help lower your prescription drug costs and protect against higher costs in the future. Once enrolled in Medicare, the retiree and their Medicare-eligible dependent will have the option to enroll in a health insurance plan offered through the GBP. The first option is the Health Select Medicare Advantage plan administered by United Healthcare. This plan is a Part C plan, which works together with Medicare Parts A and B. There are no out-of-pocket costs when visiting providers. This means no copays, no deductibles, or co-insurance. The retiree and/or dependent does not need to designate a primary care provider or need referrals to see a specialist. Doctors will need to bill United Healthcare and accept Medicare. The next option is the Health Select Secondary Plan administered by Blue Cross and Blue Shield of Texas. This plan has a $200 annual deductible per participant, $600 per family, and participants pay 30% co-insurance. The retiree and/or dependent does not need to have a primary care provider on file or need referrals to see a specialist. Doctors would need to bill Medicare as primary, and any remaining costs are submitted to Blue Cross and Blue Shield. In both plans, participants are enrolled in the Health Select Medicare RX plan, administered by United Healthcare. You will have a $50 annual deductible that resets at the beginning of the calendar year. You can compare coverage and cost information for both GBP retiree health plans at ers.texas.gov/retirees/rates. What happens when one member of a household becomes eligible for Medicare before the other? In this first scenario, the retiree is eligible for and enrolled in Medicare Part A and Part B, and the dependent isn't. This means the retiree can enroll in a Medicare plan and the dependent will remain on his or her non-Medicare GBP health plan. Once your dependent becomes eligible for and enrolls in Medicare Part A and B, call ERS to provide your dependent's Medicare information. ERS will enroll him or her in the same health plan you're enrolled in. Once the retiree and dependent become Medicare eligible, they must be enrolled in the same health plan. What happens if the retiree isn't eligible for Medicare and is not enrolled in Medicare Part A and B, but the dependent is? In this scenario, the retiree remains on his or her health plan and can call ERS to enroll the dependent in one of the GBP retiree health plans and the Health Select Medicare RX plan. Once you become eligible for and enroll in Medicare, don't forget to call ERS and provide your Medicare information. Once received, ERS can enroll you in the retiree health plan you want. What if an active employee, whether eligible for Medicare or not, is enrolled in a GBP health plan and has a Medicare eligible dependent who is covered on the active employee's plan? Active employees and their dependents are not eligible to enroll in either Medicare plan because the state's health insurance remains primary to Medicare. If your Medicare eligible dependent stays under your health plan, he or she can still enroll in Part A. There's no monthly premium, but delay enrollment in Medicare Part B until you retire. If you become eligible for Medicare while actively working, you can still enroll in Part A, but delay enrollment into Part B until you retire. Once you're ready to retire, whoever is eligible for Medicare should contact the Social Security Administration before your retirement date and request to enroll in Medicare Part B, with the effective date being the first of the month following your retirement date. The SSA should send you or your dependent a form to verify that you were employed and your dependent was under your active employee health insurance. Take this form to your benefits coordinator or HHS enterprise for employees of an HHS agency. Once your benefits coordinator has filled it out, be sure to send the form back to the SSA to avoid any penalty for enrolling in Medicare Part B outside of your initial enrollment period. In review, in the first scenario, the member, a retiree, is enrolled in Medicare, but the dependent is not. The retiree will enroll in a GBP retiree health plan while the dependent stays on his or her non-retiree GBP health plan. In the second scenario, the retiree is not Medicare eligible, but the dependent is. The member will remain on his or her GBP non-retiree health plan while the member enrolls in one of the GBP retiree health plans. In the last scenario, the member is actively working, eligible for Medicare or not, and the dependent is Medicare eligible but is enrolled in the member's health plan. The member and the dependent will remain on the non-retiree health plan until the member retires. When the member retires, whomever is eligible for Medicare needs to enroll in Medicare Part A and B. Once they receive their Medicare card, they must contact ERS with their Medicare information. The member and/or dependent will be enrolled in a GBP retiree health plan. Once the retiree and dependent become Medicare eligible, they have to be enrolled in the same health plan, Health Select Medicare Advantage Plan or Health Select Secondary. Prescription benefits for both plans are provided through Health Select Medicare RX. Thank you for taking time to learn about Medicare and split households. If you'd like to learn more, you have resources available to you. Contact the Social Security Administration toll-free at 800-772-1213 or visit www.ssa.gov to find answers to questions about enrollment or premiums. Call Medicare toll-free at 800-633-4227 or go to www.medicare.gov if you have questions about coordination of benefits or coverage. Contact ERS toll-free at 877-275-4377 Monday through Friday, 8 a.m. to 5 p.m. Central Time, or online at www.ers.texas.gov. Be sure to also check out our Facebook page and YouTube channel. We hope this information is helpful.